I don't, because if my heart just decided to not beat today, it done.
And you can't, you there's nothing you could do to restart it. But you see, this to bring me to what I think about is more like consciousness. Like, what is consciousness? Like, who am I? And you see, the thing about it too, what if you think about it like your body being this one being, like its own vessel, but your consciousness just inhabits the body. So it's actually like two separate entities. And so that's why you don't control the body. You're just housed in the body. Almost like we are living on the planet. We don't tell the planet what to do, but we're just kind of on the planet.
Yep. So it's just really, when you have to think about it, like, there's a lot of, that's when you like go down the loop, the rabbit hole of thoughts.
Yeah,
it's like, wow, like everything happens on you and inside of you without your help.
You know what's interesting too? I always think about collective consciousness. Like, I believe that we all connected in some way that we can't really exactly explain. Like, we know we interlinked. Like, we know the actions of one person today in Taiwan somehow is going to affect my life somewhere down the line. And we know that much. But I also believe that we're somehow connected through something other than consequence of actions.
Mm-hmm.
And you can't explain it. You don't know what it is. Like, I've been trying to do this thing lately where I go, treat others like they're a version of me just living a different life. I guess it's a very convoluted interpretation of the golden rule, like treat others as you would treat yourself.
Mm-hmm.
But that don't really give much reasoning for me. Like, the reasoning can't just be because it was in a book and because a smart guy said it like 5,000 years ago. So in my mind, it's more like I understand that we're all connected, and I understand that one of the keys to having like let's say a good life, right, is to live good with people. Like, if you live good with people, generally that's one of the ingredients to a better quality of life, at least in my mind. So that being said, if I know that we're connected, I know that it's beneficial to me to live good with people. Perhaps in terms of this consciousness thing, perhaps we are just one organism and we all just have a certain, for instance, just like a body. So like, I don't know if your finger knows exactly what's going on in the small of your back, but it's all part of one body and all connected. You know?
It's like a factory. They all work together to produce the same thing, but they have nothing to do with each other.
Right.
It's like, I'm just making this, and you do what you need to do over there. It will all get to where it needs to go, but what your processes don't concern me.
Yeah, I definitely see what you're saying. Yeah, so so I've been trying to do that. It's not necessarily working all the time, but for the most part, I'm trying to do this thing. Like, I'm consciously trying to go, this person is me, just living a different life.
Mm-hmm.
And so, like, give myself some grace. You know, the only problem with that is that you recognize, since everybody isn't on the same beat, that you probably don't get the dirty end of the stick a lot of times. Oh boy, but such is life. Such is life. Friend of this show, Naima, big up yourself. Yes, Team Beard. I knew she was on our team. You know, I knew that. I just had a feeling. Talking
Team
about
Beard and those that have some remnants of.
Look, I don't beard shame. Right? Your beard don't have to be immaculate like the Taliban in the caves of Afghanistan. It don't matter. Once you're on the team, you're on the team.
Teamwork. I mean, even if I'm on the bench, I'm on the team, right?
Like, okay, so I've been wearing head wraps now for how much years upon years, right? and like now that the Taliban in the news and took back over the amount of people coming up to me and being like, "Me buy you a sleeper cell." Like, it's just so funny to me. Like, walking, I went to a funeral last week, and I see this man there watching me. This man watching me. After a while, he come up and he said, "You is one of them?" I said, "What? One of whom?" He said, "One of them Taliban." I said, so hear me now. You is one of us?
The audio, you're shocking now, right?
You is one of us? But if you see the look on the man's face, right? Like the man,
He didn't know what to do.
he didn't know what to do. He actually just exited the conversation. He just left.
Poor guy.
I love it. Oh boy. But anyway, it's tea time yet? Yeah.
It always is, and can always be. But it's tea time. Let's get into it. Oh yeah. That was horrible singing, but it's still early, everybody. So please give me a break.
Walk with me.
Give me a solid break. But let's get into your September 1st tea time. As usual, we have to start this off with Jade's COVID updates for the nation.
I am going to start a petition for us to stop doing this pretty soon. I ain't started the petition yet, but just now I can, yeah.
Petition for me, thanks. So here is your COVID-19 situation report as of Tuesday, 31st of August, 9:30 p.m. So confirmed cases within the last 48 hours. That's new.
No, they actually
did that before?
yeah, it was a mistake. So they actually put out a new one. It was the same numbers, it's just that they changed it.
They changed it to 24.
So whoever was doing the infographic probably just didn't change the 48. But the numbers were exactly the same. They just sent out and said
I'm guessing that this was maybe supposed to be the Monday one, because Monday they don't release on Sunday.
Right,
so
exactly.
Maybe...
So they released one on Monday, yesterday. No, yeah, they released one yesterday for Saturday, Sunday.
For Saturday, Sunday. Okay.
And then this one is for Monday.
Monday. Well, yeah. No. So let's rephrase on their behalf. So confirmed cases in the last 24 hours stands at 30. Total number of cases that we've had since the beginning of the pandemic stands at 1,121. Active cases stands at 475. That is a lot. Recovered cases stands at 643. Number of cases that are currently active, that have been in St. Kitts and Nevis, these include active and those that are not active anymore, is at 969. So St. Kitts about to break the 1,000 mark by itself. And the number of cases in Nevis, 151. It still blows my mind how Nevis was at 20 2 weeks ago.
Yeah.
I know they're 150 something. Wow.
Well, that's the way the corona crumbles. Or spreads.
My gosh. Corona does crumble.
That's the way the corona spreads.
It's like corona crumbles and I just see like a cookie.
Corona cookie? Oh man.
So let's not dwell on COVID for long, because I'm sure there's another article we did.
Yeah, of course.
But let's talk about some CPL.
Yeah.
So CPL is happening and we can give you some results. So the results from the match have held yesterday. Trinidad Knight Riders have won by 27 runs. They have defeated the St. Lucia Kings.
That they have.
So, you know.
So on Monday,
I hope everyone's keeping up.
Well, on Monday, we were talking about Patriots, and I mentioned that the Patriots had won 2 games, which at the time they had actually won 3 games. And like people wanted to trim me out for it. I was like, but I'm not a sports journalist. I didn't know they had 3 games at the time. The games they must saw is like 2 I missed one.
Okay.
I recognize that they played on Saturday, and that's the game that I missed. Yeah, but I could say that they're undefeated, correct?
Yep, I guess.
Yeah, they're
I'm still
undefeated.
not a sports person, a journalist either, so
Ah.
I
Oh, I love it. But yeah, the CPL is picking up. I think a lot of people are looking at the games, kind of getting involved. Again, we have a lot of people from here who, support different teams, and they're also going out to the games. I had a friend last night who left the conversation I enjoy because she said she ain't gonna date her, but she going back. So people going. People going. I think that they actually also are allowing music again at the CPL. Big surprise. I think they lifted the ban. That's why I wasn't talking about that day too long. I know that they wasn't gonna stand. That they just didn't make. You got some things that you just ain't gonna stress about.
which is everything for me.
Yeah, but this is definitely one I just wasn't anxious about. Like, it wasn't gonna last. Yeah. It just be funny to me. It just be funny to me when, like, people make these decisions that obviously don't make sense, but they have all the justifications for it, and then this have to be the same person who have to come and then justify the exact opposite.
I wonder what you're talking about, Adam.
Oh man,
Well.
you have to justify the exact opposite. It's like you're debating yourself in real time. Embrace debate.
Embrace debate.
Yeah, but congratulations to TKR as well as the Talawas. The game's looking exciting. I ain't gonna lie. I got to really sit down. And watch some of the games. I don't know what games I'm going to go to. I haven't decided. See, I'm one of them people, like, I want to go to the finals. I want to go to the games that are, even if not the finals, the games that really have a lot to do with the outcome. Right, so them games are like, okay, depending on who wins this game determines who goes through to the next round. I like to go to the games where there's a lot at stake. Let's put it that way.
That's fair.
Yeah.
I know what you mean. The high stakes games where everybody on the edge of the seat and there's something at risk and everybody vexed.
Yeah.
And I'm glad that CPL is happening and all of that, but I'm also like, it's just probably so strange because the players don't have energy to feed off of. It could also be a good thing and a bad thing for me to when I think about it, because I feel like sometimes the crowd can induce some serious anxiety.
Yeah.
I think
different players deal. I think different players deal with the absence of the regular fans differently. Mm-hmm. Like you're saying, some embrace that atmosphere, and then some it adds pressure, and so they don't perform.
Yeah, because for some of them there must be so much pressure when the crowd is like cheering on and like screaming and waiting for you to do this thing, and then it don't happen, and then the crowd vexes, like you hear them like kind of booing. But then but then at the same time it also does a lot for some people. That cheering and stuff really motivates them and to get this mission accomplished. So I'm not sure how the players dealing with it, but I'm sure they do miss the cheering and the screaming and the
for sure,
the crowd action.
For sure. I mean, I know for a fact that there's some athletes that perform better when there's not that pressure, and there's some athletes who kind of relish it. I knew I was one of them athletes who relish the crowd thing, and I would always play best in the games where, especially in school, I'd always play best in the games where there was like heavy like school support and like a lot on the line. So of course, going to Bastille High, the washi games were the big thing. Right? So the washi games, I would always get up for the washi games. Like the day before, I would like go in the Carib stand and just like sit by myself and so on, like meditate and visualize everything that I wanted to do on the field and so. It was a good feeling. Like when you score in a game like that, yeah, it's very intoxicating. The crowd is very intoxicating. Or when you do something, you make a good play, and you hear the claps. Like it's very intoxicating. It could really get to your head. It really strokes your ego, to be honest. Oh, looking back, yeah, it really does stroke your ego. At the time, you don't really internalize it that way, but yeah, it does.
And one day we'll get back to that point, I guess.
Bye. We're moving forward because I'm now having this feeling of nostalgia, and again I might take up myself and decide to go kick a ball, and you might not see me again for 3 weeks.
Here's another update, Joe, from CPL. There's another one.
Oh, okay.
I didn't scroll down the page fast enough. There's another one. So another match result. We have the Barbados Royals versus the Jamaica Talawas, and the Jamaica Talawas won by 6 wickets. So I think these photos are so, like the photos that they've been taking, they're so cool. Like they really start to capture the moments. Very posterish. I mean, they're using them on posters, which is great, but they're very posterish, which I like. But
yeah, definitely. There's and I think that's the gift of really good event photographers, when able to capture feelings and emotions and moments like that. So yeah, big up to the CPL media team, Jade included.
No, just okay.
Yeah, let's include Jade today.
Well, yes, big up to the CPL media team. I know they've been doing a great job so far. They've been really keeping CPL's media alive and going. The engagement has been high. The captions have been fun and funny.
Especially because there's limited crowd. They're not moving around to different islands. They're in one island. So this is the way that people are able to interact with the league. And so I think it's very important. That point of contact is very important. So yeah, big ups to themselves, because they've been keeping the interest going. Even if I don't watch the games, I'm still going. I'm still looking at what's happening. I'm still trying to keep abreast of what's happening. So yeah, for sure. Big up.
Big up yourselves, everybody. Bro. Big up yourselves. Listen, I am tired of people commenting on my sighing. I just sigh because it's nice to release a breath every now and again, a proper breath. So
yeah, sigh away, sir.
Yeah, because people ask me, why you stressed now? You're always sighing, and I'm like, no, I'm just.
It's a way to release.
In breath.
Yeah, it's a way to release. Yeah, I got you.
Because for me, if you really think about it, we just breathe sometimes. But have you ever really taken a deep breath, a proper deep breath, and released it in all of its entirety? It is very relaxing and very grounding. So I recommend sighing a few times.
I do breathing exercises when I go to my bathroom in the morning. Like I just look at myself in the mirror and do breathing exercises. Like literally like 20 seconds in a bigger deal. But it'll definitely get you up and going. I don't know what it is about it, but it's a thing. Trust me. I would like to be like one of those people who able to, yes. I'd like to be one of those people who come out on the landing in the morning and just look out over like a picturesque landscape and take deep breaths and look very meditative and have someone capture it. But
I do all the time. I mean, I do. That's me. Just nobody does video to capture it.
I don't buy that definitely hear me. It used to be, but no, I don't buy.
No, it's me. It's nice. It's nice. I sometimes try to wake up in the morning ahead of time and do a little breath, get myself together. But lately, I've been finding it very difficult to roll out of bed. So
you know what it is, too.
Pause,
for the last couple months, if I decide to come out on my landing in the morning, I would have to probably tell the troop of monkeys, like, to please excuse and give me a few minutes to just relax. The amount of monkeys that be in my yard in the morning, right? This is ridiculous. It's ridiculous. Like, I'd be like, but I ain't gonna come running up because I seem to be doing very well. No social distancing going on with the monkeys, nothing. They're just up and down the place. There ain't social distancing there, obviously not sanitizing. But they're just all over me. But I look out at my landing this morning. It just got a monkey there watching me in my bed. I was like, bye. Okay. No, bye. We got the monkey there one time, yeah?
One time.
Yeah, only once. Gotta overdo things.
Yeah, listen,
bro.
I can't tell you what just went on in my mind.
Bro, I just looking at your face, right? I was looking at your face.
One time just happened, and Dexter up to start playing me.
Oh man.
Let's together here because let's move on to some more tea time, hee because one time, Mama ran back down, then Papa finally me. Anyway, so a new tropical depression has formed in the eastern tropical Atlantic. The U.S. National Hurricane Center, the NHC, is monitoring newly formed tropical depression 12. There's no coastal watches or warnings in effect at the moment, but as of 5 p.m. Atlantic Standard Time, this was yesterday, the Center for Tropical Depression 12 was located over the far eastern Atlantic Ocean, about 335 miles southeast of the southernmost Cabo Verde Islands. The depression is moving towards the northwest, near 16 miles per hour. So if this develops into a depression,
it's a tropical wave right now, right?
Right now, it is a it's saying a newly formed tropical depression 12, but then it's also saying that it's a storm. If it forms into a storm, tropical storm, it can be named Larry. That's the name that's gearing up for it.
Okay.
Larry just sound mean.
I know a couple Larrys.
So meanwhile, though, the NHC is giving an update on Kate, who is in the middle of nowhere. Love that for her. And they said that there are no coastal watches or warnings in effect because Kate is literally spinning in the middle of the ocean, going nowhere, and that is what we like.
So Kate is a festival flower girl?
And the person who does still party when do that in the middle of the street by themselves.
Right. I got you. Big up, Kate.
Hey, there's always that one person who's still partying after the party done.
Bro, I used to be in amazement at the hippie flower girls at the festivals. I could not understand for the life of me how they could keep spinning in circles like that and not get dizzy and fall down.
I spin in circles for 2 seconds and I drop down.
Bro, they'll be spinning in a circle for like 8 minutes and literally just stop
and walk off. No, you get it wrong. They spin in a circle for 8 minutes and then stop and then spin in the next
The next
direction. For another
direction.
8 minutes.
Right. Oh my gosh.
And then when they finish, they either walk away or they just hit the ground and smile. Like
Oh my
bliss,
gosh.
like in absolute bliss.
Hippies by. I used to hang out at this hippie commune, and I must say, life is so much simpler. Life is so much simpler for them. Life is so much simpler.
I don't want to ask any questions about that, to be quite honest.
No, life is just so much simpler. They're not worrying about the manager who ain't like them. You know what I mean? It's just,
I guess.
But you have to understand,
life,
right? A lot of times we see people and people just seem to have like a lot going on. Like they're angry or they're just not pleasant. And it's like very difficult for some people to be pleasant, yeah. Like you wake up in the morning. You wake up in the morning, right? Tired from last night. You know you're going to do something that you're not necessarily fond of. You don't really see a way out of it. You have to go stand up in the sun, catch a bus. Sit down on a bus. Wait in traffic, start, stop while the bus pick up people. You get to work, you walk from the bus stop down to your office and then sit in a cubicle for hours on end. And the highlight of your day is the 2 minutes where you get to go to the bathroom and look at your phone. Like, how could you not be just like upset? Like
miserable.
Yeah, we rough out there, my boy. Trust me, we rough out there. I just look at them. They just wake up in the morning and jump. It's like, oh, I feel like having a shower today. I just gonna jump in the river naked.
And I knew somebody who, the whole not being able to do anything until like 2 minutes. I remember one person told me that they used to have to put their phones on do not disturb, which means it completely silences the phone.
Right.
Phone don't vibrate, the phone don't ring, because they used to say that they used to stress them out that their phone buzzing all day and they have no opportunity to even glance at it. So they had to like silence the phone for their own sanity.
Yeah.
That is stressful.
That in itself is stressful. But at the same time too, I have been trying to extend the amount of time in between my phone checks. Like, not the phone checks because it vibrated or it rang, but just the random phone checks. Like, sometimes you're just there and you're just like, take out your phone and open Twitter, or take out your phone and open whatever. Like, I'm trying to really limit those interactions. I feel like it's too much, and I already consciously have made changes to don't do that, but I'm trying to extend it now. So if I get a call or I get a message, yeah, check that. But I'm trying to not constantly just be in my phone all the time. I feel like I'm missing a lot.
I've been doing less pickups lately, like, picking up my phone less, to check less. And what also helps is that, this is not an advertisement or anything, but an Apple Watch actually really, really helped me to take up my phone a lot less, because it allows, so if something does buzz, all I have to do is glance at my wrist and I can see if it's something that I should have, because the thing is, if my phone is in my hand and my phone buzzes, I would unlock my phone to go see what it is, and then I find myself doing something else on my, so even if it's just like a spam email, I'm now on Instagram or somewhere else.
Right.
Elsewhere on my phone. But if the watch buzzes, and I also have it set to only buzz for certain things. So if it buzzes, I check it. If it's a text, I could glance at the text quickly and see if it's something that could wait, or if it's something that could be answered quickly. And if it's something that could wait, then I just don't touch the phone.
Yeah,
so
it could discern. Yeah, it could discern.
My phone much less. So I mean, it's been a great use. The plus side to it, it also extends my battery life because my phone is in my hand all the time.
I got you. I know what you mean. I know exactly what you mean. But yeah, it's something that I'm purposely trying to work on, and it's been good so far. I don't like feeling like I don't like feeling like this thing has like power and like power on me. You know, I've been watching the wrong live all the time and wondering where all the fans be this morning. Anyway, morning Witty, morning J to the well start for the morning. SH, big up yourself. Axman, yes I.
Everybody.
Yeah.
Everybody.
Everybody. Like I like that nice little community we have going on there. Good people.
The nice little what?
Community we have going on online.
Oh.
Yeah.
Fun stuff. Fun stuff.
We're supposed to have a friend come visit us this morning, you know. What time she's supposed to come? 9 o'clock? Yeah, 9 o'clock. So we have some time to run through a few more stuff, yeah, before we break.
We have a few. I Axman really used to leave me alone. Let's talk about some big pharma stuff. So the potential HIV vaccine has fallen short in a mid-stage study. This is a Johnson vaccine.
No. I've been waiting for this. I'm waiting to see what happened with this vaccine.
My faith in Johnson is very low.
Yeah, but I'm waiting to see what's going on. I wonder if the people who are against the COVID vaccines, if they're going to be against the HIV vaccines too.
Possibly, because now I feel some of them will be forced into being against it because they have to ride the same train. But
I think people.
Hopefully, they can understand that things aren't. Different things aren't the same. But
we have to wait and see.
So we'll see. A potential HIV vaccine is being developed by Johnson & Johnson, but it did not provide protection against the virus in a mid-stage study, which is what the drug maker said on Tuesday. Johnson & Johnson's plans to end the study, which involved young women from sub-Saharan Africa. But researchers will continue a separate late-stage trial involving a different composition of the vaccine in men and persons who are transgendered. The study of sub-Saharan African women involved about 2,600 persons who were deemed to be at high risk of acquiring HIV, which causes AIDS. The persons were randomly selected to receive either the vaccine or placebo. Researchers found that the vaccine was only 25% effective at preventing HIV. To be completely honest, I think 25% is a lot.
Bro,
I mean, it shows that we're getting somewhere, you know?
But bro, I am sorry. I'm sorry. Like, am I the only person who feels like these trials here are just like so weird? Because because some people get in the placebo. Eh? So imagine you get this thing, you say it's supposed to protect you from HIV. So you think you have this thing in you that's going to protect you from HIV. And then
you're just going out and doing things that put you at risk.
Yeah, bro, like that. And then there's only 25% of the people tested was able to really get some protection like that. It was like, some of them to all them other people.
It's weird to me.
That mean them other people contracted the virus. Like, wow.
Yeah, it is a bit weird to me. So.
Medicine's a weird thing, man.
Massive cringe.
Yeah, yeah. And I might not have all the facts, but bro, that just makes me feel very uncomfortable. Oh, you know what? You know what's the one thing though with the HIV that I really hope would take up and become popular? The home test. We've had the home test kits for HIV for years now, and I don't see people having them. Is it? I don't know. I don't know.
It's like a 1 hour test. I think you get your results in like an hour or 30 minutes or something.
Something like that. But I mean, I think I want to believe it's the same kits they use at the health centers, and the test, the results come back instantaneously. Like they happen instantaneously. You get the test. So you go to the health center, they prick your finger like as if they're checking your sugar level. right? Squeeze your finger, put the little thing by the blood, and then like in 2 minutes it tells you your status. But I don't know people like, to me this, but I wonder, they can't be sold at the pharmacy.
I don't see why they shouldn't be.
Yeah, we need to
as well as self COVID tests, which they do sell in other countries. Some countries give them away for free.
Yeah, the home COVID test.
The UK gives you home tests for free.
Yeah.
The US, they have lots of free testing centers, but they also sell home kits.
Walgreens been testing people for free in a lot of the different states in the US.
Right, Walgreens been testing for free. I think some CVS tests for free.
Yeah, but Kevon, let's take this call. We have somebody trying to get in on the conversation. Actually, they couldn't stand to wait, but we have somebody else trying to get in. Good morning, you're live on Island T. What's up? Good morning. Okay, we lost those calls. Sorry, but feel free to call back if you want to join the conversation, guys.
Yeah.
But yeah, so I'm really hoping that some of these things become standard. You know, all these things become.
Oh, right, we were talking about testing.
Right. But yeah, so. Oops. Yeah. So yeah, I'm hoping that some of these things become standard, and people have more access to these tools. Because I've been hearing about these things for years. There's these treatments that suppress the virus and stuff like that. So hopefully we see these things becoming more and more prevalent, and like I said, easy access to. Oh, the green light going. Let's try this one. Good morning, caller. You're live on LNT. What's up?
Good morning. I'm looking for some tea.
Morning. Well, we got Bush.
Morning.
We got Bush and we got Milo.
You got the high bush or the low bush?
All in between.
Yeah, I like to mix up the bush tea, and I don't drink this one bush story. I don't believe in it.
Remember though, it has to be odd bush. You can't drink even bush.
Well, so go for 5.
5? Yeah, we could make something with you. Okay, blend.
It is 1, 3, 5, 7. You see, by I tell you, our parents were smart. They were teaching you odd numbers.
Yep.
But when they go to make, they trying some bush there. It was some. It was never ever now. If somebody come up with that one there, but when I growing up, they said try some bush in the pot for me.
Mm-hmm.
Anyway, let me get in on the thing with the trials.
Right.
Now, in any truly scientific study, you must have what is called a control group. So whether you give anything or not, so some people would get the test and some would not. Because you cannot tell if it works if you don't have a control group.
Yeah, some people get a placebo.
Yeah, but you see, nobody knows who get it.
Yeah.
That is where the control group come in.
Mm-hmm.
You know?
Mm-hmm.
So it isn't that they just go and say, well, you're going to get placebo. And these things are done scientifically.
No. We understand it. We understand the scientific approach is just at the end of the day when you think you're talking about people. Yeah, you think we're talking about people. That's what I was getting at.
Tell them up front, look, we're gonna have some of you going to get this and some of you not going to get it.
Mm-hmm.
Because they must know.
Yeah.
Now the one you talk about the test, there is something called comfort when somebody give you certain kind of news. You do an HIV test home and it say you're positive. You either go into denial or you may even freak out. Denial is the easiest way, but I don't believe this thing, right? Like pregnancy test. Pregnancy test. Mm-hmm. You do pregnancy test and you say you're pregnant. But you say, no, that can't be. You know what I mean? You go into denial. So there is something about doing the test with somebody else. Because when you go to do the HIV test, they give you counsel before, And after they give you the result, they give you counsel. You're home by yourself. You know how traumatic it could be? Some test results are very traumatic, some are not so traumatic, but some of them, some people may even kill themselves. You know, so sometimes, even though it could be, because they were saying, a doctor was on Carib Vision, talking about this COVID and so. I think he was saying that you could buy the antigen test.
Yeah, you order them on Amazon.
Amazon, I think he said 2 of them for $24 US. So he was saying, well, maybe the governments need to take off the duty or whatever. But there is always a problem of self-denial. Even when you're big and you got the doctor say, "Boy, you got blood pressure," you say, "Boy, no, I believe that."
Well, yeah, I was about to make that point. Some people get it direct from the doctor and still don't believe. But the other thing...
denial. You see, there's always... I remember when I was diagnosed with diabetes, I say, even my friends and my coworkers were saying, "You don't eat a lot of sugar and you are drinking water." I didn't even realize drinking water every minute was a sign. You know what I mean? I really can't tolerate a lot of sweet. But I have been drinking water and going back home. And when the doctor said, when I did the test, I didn't even go for that. I went for another blood test, you know what I mean? And they come and tell me they wanted to check me. And even when the doctor came to see me in the hospital, because you know, they said they're going to bring it under control, she said, "Miss, and even when the reading, I see that it can't be you. I came looking for somebody who was dying and all of that and all of that and all of that." You know, but I had to adjust my mind to it and start right away. So I believe sometimes if you know you are that kind of person, rather than delaying the test, go to the clinic, go to the health fair in the thing. And the HIV one, it's better for you to know than not to know.
Precisely.
Because, I mean, in Russia, so it is a crime, you know. If you know and you pass it on to somebody, you're considered a murderer, unintentional as it may seem. So we might have to get around to the corona like that. In some countries, they charge you, you know, if you are positive and you deliberate, say you break quarantine then, you are charged. And maybe that is where we need to go. So anyway, all of you know to pray. Good morning, Claire. I'm still waiting to hear your voice, you know.
Yeah, waiting to hear from my friend too.
Yeah, you see a woman that done man so? Eh? And when they done, they say man can't take done.
What?
I go on.
What? Poor Theo. Theo, I want to believe that Cleo is still head over heels for you. So don't think it's that you're talking about. What is happening? Oh man. Wow. Yeah, that is yeah, but I mean the you know, the callers is talking about the fact that I just think options are good. And there's some people who would prefer to have that moment be private than to even, you know, be talking to a nurse or whatever, especially in smaller societies like here.
Yeah, but you know, a part of it too is that they intentionally make these things in the office because these nurses and health practitioners are trained in managing you in the moment.
Yeah.
So, you know, part of why they don't how to say it. Part of why they don't let you test at home is because they want to be able to make sure that you react safely.
Yeah,
you know.
I mean, but the truth is that it is available. Like you could go and buy it. It's just not promoted. It's just not promoted, and I believe that it should be. I believe in options. Give people options and let people choose what they're gonna do. But yeah, I mean, even now we see it with the COVID thing. Like some people, they know they're exposed or whatever, and they don't go get tested. Like they just don't. They don't want to deal with the possibility. They just rather to go along their lives as if there is no threat. But Kevon, we're gonna have to take a break and come right back because we have in studio our friend, yes, singular, So we're gonna be right back, and we're gonna take a quick break and come right back, guys. Stay tuned, stay locked to WINNMedia SKN for Island Tea right here. See you.
Run to Hosford's Furniture and Appliances in Ashley Furniture Home Store now and get a chance to win free groceries for 1 year. By popular demand, Cashback is back, but this time Cashback is back with more quality appliances, more great prices and fantastic deals, more of Hosford's fabulous FlexPay payment plan, and more free groceries. A whole year of free groceries. Come to Hosford's Furniture and Appliances in Ashley Furniture Home Store today and get absolutely free groceries with every higher purchase and a chance to win free groceries for 1 year. Great deals on furniture and appliances. Get cash back for free groceries with FlexPay higher purchase and a chance to win free groceries for 1 year with every $500 spent. All great reasons to shop at Hosford's Furniture and Appliances in Ashley Furniture Home Store this coupon season. Terms and conditions apply. See stores for details.
Maybe it's the way the brilliant gold liquid reflects our sunshine, or how the bright blue of its label mirrors the clear Caribbean skies overhead. Maybe it's the fresh, crisp taste of this beastly cold beer on a scorching hot day. Maybe it's even the way it brings us all together. But one thing is for sure, Carib is very much a part of who we are wherever we're from in the Caribbean. Carib. It's the way we play. Drink responsibly.
The symptoms of the coronavirus are similar to those of the common flu or cold, which are consistent coughing and sneezing, fever that does not go away, and difficulty breathing. If you are experiencing any of these symptoms, it is advisable to stay at home until you recover, or if you want to go to your doctor, call first and tell your doctor of your symptoms, any recent travel or contact with travelers. And lastly, please avoid spitting in public. Recent cases have shown that people most likely to be at risk if they contract the virus are persons over age 60 and persons that have an underlying medical condition such as hypertension, diabetes, kidney disease, or a respiratory condition. It is advisable to avoid large crowds or other places where you might have to come in contact with people who are showing signs of the coronavirus. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Hold on, stop. Think about the drink before you take a drop. Read up on the label on the back. They say science sugar low in fat, but don't be fooled by that. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody you're sweet enough. Drink some water, share some love. Tell your body you're sweet enough. Drink some water, share some love. Tell somebody, hey.
Welcome back to Island Tea with your favorite Kevon and Azem minus Jade, Gwen Johnson, and it is time to jump into conversation with our friend from Lake. I just mix it up. Lake Health and Wellness. Yes.
Being. We want your entire being to
The
be
being.
well. Your
Lake,
being.
Lake Health and well. Okay.
It's okay, Kevon. We'll work on it. It's okay. I forgive you today. Well, thank you very much. Good morning to everyone who's tuned in, locked on radio or online and viewing. Again, my name is Iseline Phillip. I am the Advocacy and Research Officer at Lake Health and Wellbeing. That is your public health NGO here in St. Kitts. And we work to improve the health and well-being of our communities by doing different projects, carrying out research, leading advocacy, and coordinating different campaigns. So I'm here every month here for your monthly dose of Health and Herbal Tea, where we talk all things health and wellness. Maybe not all things, but particularly related to non-communicable diseases and the awareness that we're trying to build around that and things we can do to improve and prevent and control the development of non-communicable diseases across our federation as well as regionally. Okay, so this month we start 1st of September, y'all, and we are really in this month. Actually, Max, it's a big month for advocacy around non-communicable diseases. So did you all know that next week actually marks the global week for action on non-communicable diseases? So next week from September 6th to 12th, that's actually the global week of action on non-communicable diseases. And the week ends September 12th. That is Caribbean Wellness Day. Did you know we have a Caribbean Wellness Day that we celebrate every year?
I did not.
You did not? Okay,
I did not know that.
Yeah, so this actually is, all the CARICOM leaders came together and was like, yep, we should mark a day where we all join together and concentrate our combined efforts on reducing the NCD burden that we experience as a region and, of course, globally. So we see those two things coinciding. And, I don't know if you remember last time I was talking about SK and Moves and the 7-week campaign that is also ongoing. So all of these things are kind of culminating right now around in September, just before we go into independence celebrations. So just important for us to note and know that these commemorations, these things are happening. And again, these observances, so both Caribbean, the Global Week for Action on Non-Communicable Diseases, which is next week, the 6th to the 12th, as well as Caribbean Wellness Day on September 12th, they both promote action in confronting non-communicable diseases and the risk factors. So this is how global efforts and global movements really are calling persons to action for us to take a really unified approach to prevent and control the development of non-communicable diseases. And this is particularly because we recognize the burden of these things. So when I talk about the burden of NCDs, so I've been coming in here and we've been talking about that a lot. And I'm here to do that to remind us, especially in the midst of COVID, which seems to overshadow a lot of things, that, we also are in the middle of an NCD epidemic. And so one of the things that we found that is actually forecast is that the NCD burden, if we don't tackle it, is forecast to increase 17% by 2025. Did you know?
How much percent?
17.
It's already out of control.
Wow.
It is already out of control, exactly. And that's 2025. Dying to fire. Like, we're already going to 2022. And, I still trying to process 2020. But it's like, oh, okay. But so this is kind of trying to highlight, just to give people a sense of what we mean when we talk about the NCD burden. We're talking about both the social and economic cost of non-communicable diseases. So social costs, we're thinking about obviously the things that happen when it comes to increased disability, early onset death, and how that affects families, the extra care that families have to give to persons, the lower productivity that people have, and the ripple effects of those things, because then you have people dying at a younger age, you have children without parents, and those kinds of social ills that we may not be able to identify at the moment, but we know they're ripple effects of persons who suffer from NCDs, and these are the social burdens. But in terms of economic costs, we also know that NCDs are actually a major economic cost. So to give some people some statistics, and just to get our minds recognizing how much of a burden financially NCDs are. So in 2015, the World Bank reported that continuing care treatment for diabetes and hypertension in St. Kitts and Nevis accounted for half of total public health expenditure. So half of total health expenditure. So let's say, and they estimated, so we spend just about $1,800 EC annually to care for one diabetic patient. This is just one person with diabetes annually.
What's the figure?
$1,800 EC. No.
And when you say care, what does that mean?
So care, we're talking about things like medication, the visits to the hospital, and people who might end up being the kind of insulin treatments, these things that persons need to make sure that they can be sustained through the public health system because of their diabetes. So $1,800 annually per diabetic patient, and remember our diabetes prevalence rate. So about 23% is our prevalence rate, so that's about a quarter of the population. Now, if we want to put the big figure on this, so like a quarter of our population, we have like 53,000 people roughly. A quarter of that is about 13,250. So that multiplied by 1,800 is actually about 24 million EC we spend every year on, that's just treating diabetes patients alone. That's a rough estimate. So that's just, to highlight what the economic burden, and if you want to translate that into US, that's about $9 million we spend on treating diabetes patient annually. Again, rough estimates. I don't have the exact figures, but this is just data that I've found.
Right. And this is expected to rise.
Right, exactly. And it could potentially be higher because, like I said, I quoted it from, I kind of estimated it from a stat that I found from 2015 that was reported by the World Bank. We're in 2021 right now. So that's forecast to rise. And so, this burden that we feel, it is felt in even immeasurable ways, and ways that we don't see in terms of the social impact, which is why there's a lot of it's why I'm here. We advocate so much for doing the work that we do, and as well as the global alliances. So there's global NCD alliances across the world, across the region, that are actually advocating for us to find ways to prevent and control the non-communicable disease issue that we're facing. And so today, I want to recognize that, we, at Lake Health and Wellbeing, one of the things that we're very big on is collaboration and partnership. And so I've always talked about the relationship we have with the Ministry of Health, which is very positive. And because, we recognize that, while government does play a significant role, an essential role, it does require an all-of-society approach for us to really tackle the NCDs and do what is needed. So, in fact, just last week, I don't know if y'all remember last time I was here, I mentioned we were doing a week of activities for SKN Moves, the Drink Water, Your Sweet Enough Drink Water Week. And we have our challenge ongoing. So big up the persons who are actually taking the challenge, our No SSB Drink Water Challenge. So that's ongoing. But we had last week a panel discussion as part of the week of activities. And that panel discussion, the topic was actually it was about an all-of-society approach to tackling NCDs and promoting healthy eating and drinking. And we had representatives from different sectors. So we had a representative from the Ministry of Health, from the media, from Youth Parliament, from the Evangelical Association, and from the Medical and Dental Association. And I was also there as host and moderator for that, contributing from the standpoint of NGOs and CSOs. And so, it was a really fruitful discussion. And for anybody who's interested in viewing that, you can find it on the ZIZ YouTube page, as well as our Facebook and social media platforms as Lake Health and Wellbeing. But I kind of wanted to have a couple clips here because I think it's really important for us to, one, understand what government is actually doing and the types of policy interventions that they're considering. And, that's the work that we are here supporting them with to make sure they can execute. And my intention is, as we come through, because now we are in September, we're going to be mobilizing a lot more and doing a lot more public consultation around actual policies so that we can actually see something potentially approved and passed by cabinet. And so I want to start. So I have a little clip here. So this is from the panel discussion. I know from our survey that we did at the start of the campaign, we kind of did a little opinion survey, and we wanted to find out if persons thought, NCDs were a problem and what they think the government should do. So I'm going to play a little clip. So the person speaking is Dr. Marissa Catty. She is the NCD program coordinator for the Ministry of Health. And this clip is kind of listen to hear exactly what the government is doing in terms of programming. So just so people have an idea of to recognize that it is a priority area for government, for a Ministry of Health, and they're doing certain things. So go ahead.
Okay, thank you, Aisley. So one of the main pillars of the NCD program is prevention. And this is being able to provide information to the public about how best they can develop or maintain healthy habits in order to live a healthy life. Now, in order for us to do this, we have to consider putting in place certain programs and even the development of certain policies in order to accomplish this. Two of the programs I will mention now would be our chronic disease self-management program. Now, this program is actually a community-based program that is designed to teach persons living with chronic diseases, as well as their caregivers, certain techniques and tools that they can use to help to build confidence in their ability to manage their own conditions. One of the things that is stressed in this program, for example, is just the ability to be able to speak to your general practitioner. Being able to ask them questions about your condition, being educated about what is going on with you so that you are better able to manage your condition. So that's one of the programs we have, which is the Chronic Disease Self-Management Program. Another program that we have instituted just recently, as a matter of fact, it was launched in 2019, is our SKN Moves program, of which this week of activities is a part, so we're very happy for that. Now, the SKN Moves initiative is actually a program that would help us here within the Federation of St. Kitts and Nevis to create a healthy lifestyle culture. And that culture is going to be based on 3 pillars, which is healthy eating and drinking, regular physical activity, and then regular health screenings. We do understand that eating healthy is very important, and being able to make those healthy choices is important. And so the SKN Moves program will be used to help to educate persons on those areas. The nutrition program within the health promotion unit of the Ministry of Health works along with the NCD program in this aspect. And then, of course, we have the physical activity, encouraging persons, the importance of moving, just getting moving. And moving can be in any form, whether it's going out into your garden, doing some gardening, whether it's cycling, just walking along a path. Anything that will allow you to get up and get moving will help to also reduce the impact of non-communicable diseases. And then most importantly, the health screenings. Early detection of certain conditions or certain risk factors within an individual can also help to prevent the onset and also the progression of certain conditions. And so health screening, seeing your medical practitioner at least once per year, getting that yearly checkup is very, very important.
Okay, thank you very much. So everybody, you just heard that was Dr. Marissa Catty, and that was a clip from the panel discussion we hosted last week. It was actually a week to today because it was last week, Wednesday, on an all-of-society approach to combating and tackling non-communicable diseases. So what she highlighted was, of course, the programs that are currently in place that the government has and that they're leading to manage NCDs. And so just want to highlight, trying to push and encourage people in terms of healthy eating and drinking. That's part and parcel of why we have our You're Sweet Enough campaign to help focus on healthy drinking. And, the Ministry of Health, they have the In Your Kitchen, which it's a weekly show that they do to show different ways of cooking healthy foods and recipes. So when we're talking about, again, collaboration, all-society approach, I think one of the things we need to acknowledge is finding, what is the role that I can play, obviously, as individuals, as organizations, because, we really have to work together on this. So in addition to kind of, the programs that we know that's happening, so there's the chronic disease self-management and SKN Moves, the initiative, we also really want to push for policies. So that's kind of what I want to kind of highlight and talk about here today, and end with that, because I plan to come back, for the rest of the year and talk more specifically about certain policies that we're actually really trying to push and lobby for.
Sweet.
So I'll let you play a second clip. So this is also, again, this is Dr. Marissa Catty, where she's talking about the different policies that are being considered. Okay?
But Iselin, before I finish, I want to also point out one other important aspect of the NCD program, and that is the development of policies. Fiscal policies are actually health promotion measures that can be implemented from a government perspective to help to manage the burden of NCDs within a particular country. As a matter of fact, the World Health Organization encourages the use of fiscal policies to encourage healthy behaviors within member states. A fiscal policy can include recommendations such as taxations, subsidies, provisions of specific health services, regulations for advertising, promotion, and labeling, as was mentioned by our media professional on this side there, as well as regulations on certain consumables such as what we eat, drink, and even smoke. And one of the most important aspects of a fiscal policy